Now, South Sudan will officially become a sovereign nation July 9th, but with the excitement comes the challenge of rebuilding the country's institutions, infrastructure and healthcare devastated by years of conflict with the north. Since the January referendum that paved the way for next month's independence, thousands of South Sudanese have begun returning home. After years of living as refugees or immigrants in foreign lands, many are looking for life opportunities from jobs, education and healthcare. Joy Mwakalyelye and Peter Jaden are with the Christian Health Association of Sudan, a network of churches providing social services. They came to Washington recently for the 38th Annual International Conference on Global Health to gain insight into how to rebuild their country's fragile healthcare system. Joy Mwakalyelye, the association's executive director, says the task ahead is challenging.
This is a country, a place where in terms of social services and needs for the ordinary person are so enormous. With a young government and with serious inadequacies in terms of capacity for us to meet the basic needs of the ordinary person. In terms of health, we are talking about access to services, to any form of basic service. So the challenge for the new Sudan is, how do you increase access to the basic health care?
Peter Jaden, head of the association's programs, says all areas of health need attention, and most of all, maternal health.
South Sudan has the worst indicators of health in the world. Our maternal mortality is 2,057 out of every 100,000. Only 25% of the population has any access to health. So everything is a need. This conference, we're talking about non-communicable diseases. That is going to be an emerging, growing trend. Currently, we are talking of communicable diseases, malaria, the HIVs, the Kala-Azars, the neglected tropical diseases. That is a big problem in the south, and the problem is going to grow.
Mwakalyelye says funds from USAID, the UN and other groups have helped address health challenges over the years. But she says more funding is needed to train health workers, many fled due to the war, and also build clinics and other facilities. She says with so much need, allocating money is a challenge for donors.
At the moment, a lot of resources have gone to the actual infrastructure development, building clinics and training nurses and so on and so forth, but very little has gone to attending to the community outreach network, to have resource persons within communities to continuously change the behavior and increase the knowledge at the household level. So about resources is that it's the allocation, what percentage really goes to community outreach.
Mwakalyelye says organizations like hers are essential for raising community awareness about healthy living. Meanwhile, the recent conflict in the Abyei region has forced thousands into South Sudan seeking health and other services. With South Sudan's population of more than 8 million spread over 10 states, Jaden says this further compromises efforts.
And unfortunately, even the health systems are very limited for the citizens. So the internal displacement of people from the regions of conflict or from the border regions, South Sudan borders a lot of countries. Every time there's a conflict, there's an influx of refugees. Strains the health systems in those places and causes a further deterioration in the health standards of the population.
With South Sudan's Independence Day so close, the hope is that the international community will step in to address all challenges, including education, housing and other needs, ensuring the new country takes off on a sound footing.